Hi, this is Isaac Tawil. I'm a general dentist practicing in Brooklyn, New York. I've been practicing since 2003 and graduated from New York University. I also have a master's degree from Long Island University in biology. We have a strong emphasis here at Tawil Dental on comprehensive dental care, ranging from hygiene all the way to endodontics and surgery. We have a strong focus on digital dentistry and taking care of anxious patients, trying to create a comfortable, relaxed atmosphere. We have a wonderful staff, a team of 2 hygienists, 3 clinicians, and fantastic assistants and front desk office management as well. Our focus here at Tawil Dental for the last 8 years, since my father and I joined forces, has been on trying to create an environment where people can feel comfortable and that we create an environment that surrounds people with the latest technology, a comfortable, warm atmosphere. One of the most fundamental portions of digital dentistry is intraoral scanning. We have a number of scanners in the office, and of course the latest addition, the Medit i700 to the office. The first thing you'll notice when you pick up the i700 is its nice new sleek design, more ergonomic, lighter, more comfortable to hold. Another nice feature is it's now twice as fast as the i500. What you'll notice as well is that now we have a new scanning tip. Scanning tip, reversible, making the maxillary arch easier to capture. The mirror is angled a little bit more. Those hard to reach interproximal areas now much easier to capture. One of my favorite features about the i700 is the new jog dial. Without ever having to go back to the computer, I can advance from the maxillary arch to the mandibular arch to the bite. I can zoom in and out. Upon viewing these features, I can move the objects over and even rotate through them. So from start to finish, once I put my gloves on, I no longer need to take it off. Additionally, this little button over here, when it lights up, UV light disinfectant. So we're constantly cleansing while scanning, or at least while this button is on. That's a new i700 by Medit. Using the new upgrades in the Medit software have improved functioning with smart color filtering as well as soft tissue filtering. Advancements in the multi-occlusion and multiple bites analysis, as well as margin line creation. We have amazing updates in terms of facial scanning, abutment and scan body matching. Denture and impression scans have all been improved. And of course, it integrates with all the workflows. Medit apps, including Smile Design software, ortho simulation, and the crown fit features have also been improved. One of my favorite features is the quadrant stitching. We can scan one quadrant, scan another quadrant, and then actually stitch those together with amazing accuracy. That's the amazing new updates to the new Medit software.
So basically I came to Dr. Tawil's office because my tooth was killing me. I woke up. I wanted to go to someone basically who I felt comfortable with, that's current with all the current, dental procedures. So I know Dr. Tawil for the past 3 or 4 years. I've seen him on Facebook. I know he gives lectures. I know he's a pioneer in what he does. So I felt very comfortable in coming to him to, diagnose my situation and fix it.
So what I'd like to do next is to take a 3D scan and evaluate this a little bit more closely.
What's a 3D scan? What is that?
So basically we're going to have you stand in the machine and it's going to spin, go around your head. It's going to capture all the data, the tooth, the bone, the root canal, the crown. And it's going to be able to give us all our potential options that we can have here to try to fix this situation. Over the years, using CT machines, making them a little bit smaller and developing them, we came out with cone beam technology that can be used in the office. Having this at our fingertips is paramount to success, to be able to plan our patients before we ever go and do any type of treatment. Being able to have a scanner with ease of use, to be able to take a patient into the unit, position them properly with laser light technology or blue light technology, to have the proper guidance when we're taking the cone beam, to capture the correct amount of area with reduced amount of radiation. Features such as facial scanning, so that we can superimpose our facial scan with our cone beam technology, then being able to take that and incorporate that into another software. R2 Studio gives you the ability to take the scan, the facial scan, the 3D technology, incorporate that and move it right into our 2-gate software to be able to plan for a 3D dimensional prosthesis, such as a surgical guide. We can also use this for digital smile designs, to be able to do full workflow, whether it just be crown and bridge, whether it be implants. We can use all this technology at our fingertips, and we can bring it in from the analog world into the 3-dimensional world so that we can plan our cases properly.
R2Gate was originally developed as a guided surgery planning software more than 10 years ago. R2Gate provided the best surgical result because of precision in STL matching with CT scan data. R2Gate still surpasses most guided surgical programs out there in terms of accuracy. As a prosthodontist, I always advocated the idea of top-down treatment. And I believe the best surgical results come from prosthetically driven treatment plan, especially when I'm dealing with extensive, full arch, or full mouth rehab cases. Now, R2Gate is not only a surgical planning software, but also extremely versatile prosthodontic planning software. If any dentist simply follow the steps laid out in R2Gate program, then the result will be world-class, I guarantee. Dr. Isaac Tawil sent us this intraoral scan data using Medit i700 intraoral scanner. R2Gate is famous for the most accurate positioning of intraoral scan data into CT scan data. Using the R2Gate software, we virtually removed and extracted tooth number 5. Then on the extraction model, we simply did the diagnostic wax up using this program called Easy Wax Up. It takes about 5 minutes to do the anatomic wax up like this, and it's very easy to learn. And based on this wax up, we can do the implant surgical planning. So we positioned the AnyRidge implant 4.5 by 13 millimeter in length, and we positioned it at the palatal root. He will have some fragment of tooth number 5 on the buccal area. So the surgical planning is done.
Tooth. I sent this over to our laboratory and already fabricated. Is we're going to actually take a surgical guide. This is a 3D printed guide that we had made. We made this by using the data that we collected when we did our impression scan. We combined it with the data that we used when we took our x-ray scan, and we actually printed this out on a model so we can have precise accuracy and drilling for placement of our implant. Once we have our implant in place, I went ahead and actually made you a tooth.
Wow.
This is the post that's going to be coming out of the implant in the exact position that we planned it, and a crown that's going to go right on top of it. So when we finish today, you're going to go ahead and leave with a tooth already in your mouth. A fundamental part of implant placement, especially immediate implants, is receiving an ISQ value. An ISQ value above 70 means that I have a very good chance of being able to load an implant the same day. ISQ is the only objective value that we can achieve to be able to determine implant stability. The new MegaISQ2 provides us with a portable, lightweight option with a color coding system to let us know when we've achieved the correct value. That's the new MegaISQ2 by MegaGen and Ostel. I've been placing implants for 20 years. In the past 10 years, I've become more digitized and trying to be able to perform guided surgery on a regular basis. Guided surgery has revolutionized my practice. The ability to perform accurate surgery changed the game for me in terms of accuracy and precision. The only difficulties were over the years where the cone beams weren't as accurate as they are now. I was using regular impressions. My implant systems weren't as good. 10 years ago, I was introduced to R2 gate. It became a game changer. My accuracy improved dramatically. After dropping impression material and going towards intraoral scanning, and for this procedure we used the new Medit i700, the R2 guided kit, for us to be able to deliver the implant with the exact timing that we had planned it. Not slightly off, the exact timing. We were able to place the abutment in the precise position, deliver the temporary crown, and the patient left with minimal trauma, no bleeding, and an extremely quick surgery. All this was done in just about a half an hour with photos and video. That's truly remarkable, and it can only be done thanks to all the digital networks between Medit, R2 Studio, R2 Gate, and a fabulous AnyRidge implant to be able to get wonderful torque and wonderful ISQ.
Wow, that was amazing. So I got to tell you, I've done this before, and it took, about 3 to 4 to 5 months minimum. This is revolutionary. I cannot believe I have the tooth. I cannot believe it was painless, seamless, and I can actually go back to work now. This is insane. I've never experienced something like this, and I feel as if, the same tooth is there, to be honest, and that I don't even know that he did anything. I wouldn't believe it if I didn't feel it. So this is really, really amazing. Thank you so much.
We're very proud to bring you live surgery courses throughout the United States and in Mexico and throughout the world with our educational platform. We invite you to come to one of our courses, whether it be a hands-on workshop at one of the local organizations, study club, or a live surgery venue. Please come and visit us at www.aiedental.com and see what we have to offer. We're here to teach you all you need to know, from the basics all the way to the advanced and more. Look forward to seeing you. Thank you.